Thank you for joining me again. I'm Lauren Meffin. I'm waiting for my video to start. Thank you for joining me again. I'm Lauren Meffin, certified lymphedema therapist and speech-language pathologist. I'm really excited today because I'm going to share with you an additional tip of managing lymphedema of the face. Oftentimes after surgery, after radiation therapy, there are changes to the lymphatics, okay? You may experience swelling. Some patients say, my cheeks feel full, my cheeks feel heavy. Other patients say that I feel like I have chipmunk's cheeks. And so we're puffy, okay? Now, depending on what your surgeon needed to do to your neck, oftentimes the lymphatics can change up here. Depending on what radiation needed to happen, lymphatics can change here. Sometimes the results are the same. So first we want you followed by a certified lymphedema therapist, a specialist in lymphatics. This can be a physical therapist, a speech pathologist, an occupational therapist, or a massage therapist. Now, the next thing we're going to do is your lymphatic therapist is going to teach you how to open the trunk. I'm not going to do this today because I think it's essential that you are followed by a lymphedema specialist, okay? So if you're not, ask your doctor to refer you to one and say, hey, who can help me learn how to drain this swelling? The swelling is impacting my speech. The swelling is impacting my swallow. The swelling is impacting my ability to use my electrolarynx or my speaker, okay? And your doctor will refer you. They'll find you a specialist. Okay, so let's pretend that our therapist has opened up our trunk. They have completed our face, they have completed our neck, and now we're like, okay, I'm headed home, I've got my compression garment on, but the next day I'm at home, I want to know, what do I do about this swelling in my cheeks because it comes back? Well, remember, lymphatics is a system, so it is going to continue to come back, right? It's a continual pump, and the pump has been clogged. So what you're going to do is, let's say that you're swollen on the left side of your cheek. We're going to utilize, again, you open your trunk, you drain the way your therapist recommended. Now you're going to utilize a semicircle stroke. And what you're going to do is take that swollen area and push it up and over your ear, okay? So I want you to just very light pressure. You're going to follow that area. Sometimes I find it's easier for my patients to do opposite hand to opposite side. Sometimes their surgical side, they've had difficulty with their shoulder elevation. Perhaps they're having trouble getting fingers up. Perhaps things are numb. So I like you to go opposite hand to opposite side. Remember, you're nice and slow, and you're going over and behind, okay? Now, why are we going behind? So if you've watched any of my previous videos, these are our posterior lymphatics. They are healthy. Now, sometimes both sides are swollen. If that's the case, you'll move to the other side and treat that as well, okay? And remember, you're going in semicircles. Nice, gentle, easy pressure. You're moving the lymphatic fluid. Everybody is going to have a different area of swelling. This is not a one-size-fits-all. Maybe yours is here in your cheek. Maybe it's over here. So every single person, this will be different. Learn to feel your fluid. Feel the swelling. Feel, what's my new normal, okay? And as you feel that, you will begin to find relief. You'll find decreased tightness, decreased tension. Now, if you have facial edema, you have swelling of the face, often you're going to benefit from a custom garment. A custom garment is something that your therapist will help to either get you with a specific provider for sizing you, or they can size you themselves. I size my patients, but it's something that can be very specific to your therapist and also to the manufacturer. So depending on who your therapist recommends that you utilize, then you may be measured by a different person. Now, if a custom garment scares you, it does scare most people. It can cause some frustrating side effects, like it can cause some difficulty if it's covering your lips with drinking, and difficulty with how do I keep my mouth from feeling dry. If a custom garment scares you because it makes you feel like a bank robber, that's also another report. But the truth is that compression helps the entire lymphatic system, which then helps your swallowing and your speech, your communication, okay? A second modality that can sometimes be utilized, and this is very specific to your skin integrity, is taping. So you may find that your therapist wants you to try kinesio tape, and we will create for our patients a band of taping that can pull the lymphatic fluid off of this region and reroute it towards some of what we call our auricular lymphatics, okay? So the key is working with your therapist, finding out specifically what you need, okay? And from there, we want to continue on a daily basis to help manage and treat your lymphedema. I'm really thankful you joined me today. One of the other tips I want to leave you with is exercises. So this is not only a series of moving fluid, right? There's also exercises that can be done to the head and neck lymphatics muscles, really, right? So if you can grab a mirror, practice making faces in the mirror. So you're puckering your lips, you're smiling, all of those things can help to continue to mobilize fluid. Most importantly, work closely with your speech pathologist and find out what can you continue to swallow safely. What can you swallow utilizing good oral care, hygiene to decrease your risk of aspiration, and keep these muscles moving because we know we want these muscles to move. All right? I look forward to continuing to work with you. Thanks again.